Hello, my name is James Hunter, and this is my 2 cents channel where I talk about topics from physical fitness, mental health, wellness, and topics I may just want to discuss. And today I'm going to talk about a topic, maybe you might want to, it may be considered a grown-up topic, something that kind of affects typically older people, and I'm going to talk about hemorrhoids in this video. And I want to talk about hemorrhoids specific to people who work out and exercise. There's different reasons why individuals may get hemorrhoids, women and men. And I'm a personal trainer. I'm also a counselor, and I have clients that are typically, most of my clients are middle age and older. I'm talking people 40s, 50s, older. I've had clients that are in 60s and 70s. Pregnant women, when they give birth, they strain giving birth. That can cause hemorrhoids. So women who've had children can have, or deal with hemorrhoids. There's internal, external hemorrhoids, and so on. So I want to talk about some of the information that I have researched and looked at over the years when, having clients who have this issue, and what considerations that matters for people who exercise and work out. Now, this video is just intended for me to share information. I'm not prescribing anything. I'm just sharing information that you yourself can look up on different websites or resources. So my video is just my thoughts and a conversation on this topic. So myself, fortunately, thank God, I have no personal experience with hemorrhoids, and so I'm about prevention, right? I don't want to get anything like that could be uncomfortable. Now, I do remember when I was I think I was 20 years old, and I was working at a health club, a gym, if you will, and the manager was in his mid 40s, younger than what I am right now at that back then. So this individual was telling me about when he would squat with heavier weights, he'd talk about his hemorrhoids would be acting up, and here I was all these years ago back then as a 20-year-old, thinking this was kind of odd or funny. I had no concept of what that is, or what the I guess the empathy or to be able to relate to something like that. So fast forward all these years later, I'll be 49 in just 2 months. So I'm thinking, you know what? I'm at that age where, these things that affect older people, I'm in that demographic now. Now, this type of situation of hemorrhoids, it can happen to young people, imagine, if they're in some type of a situation, like with straining really hard, maybe they're sitting down all day and so on. They're in a situation that's going to exacerbate or create that situation. And I'm going to show some websites that list what can cause hemorrhoids. Not being hydrated, lack of fiber in the diet, obesity, people who sit down all day, and so on. Strenuous weightlifting actually can be a risk factor for that. And I'm going to talk about squats as far as that situation is concerned. So what can people do from a prevention standpoint? That's what I always get into as far as my way of thinking, is that if I notice people my age and older, and I know men that are my age and older who, they have hemorrhoids. They're from straining. Some of them are because they're obese and they sit down, like people who might be driving a bus all day. Some of these individuals are just very sedentary, generally speaking, so there's a lot of sitting down, and they're obese, so they're not getting a lot of exercise, and they have a poor diet, and so they can develop that situation too, the hemorrhoids. But I have encountered some older people that were powerlifters or are powerlifting. They continue to do it. And hemorrhoids is something that they have to work around that situation. They have they call it flare-ups, or just that area of the body is that they have to sometimes take breaks and just let it get under control, or to go in remission and so on, and then they'll go back to their workouts. I'm going to talk more about that in a little bit. So that's something that kind of really motivated me to let me make a video about this, because there's a misconception that people who get hemorrhoids are just people who are obese, unhealthy, sitting down all day, and so on. But the actuality is that this can happen to people who are into fitness, working out, and exercising, and so on. So we're going to talk about that in this video, and I want to talk about I'm going to show some of the things rather as far as what can help support that in terms of prevention based on the information that's on certain websites. So I'm going to share that with you. So here's the first website, mayoclinic.org. So let's look at the causes. The veins around your anus tend to stretch under pressure and may bulge or swell. Hemorrhoids can develop from increased pressure in the lower rectum due to straining during bowel movements, sitting for long periods of time on the toilet, having chronic diarrhea or constipation, being obese, being pregnant, having anal intercourse, eating a low fiber diet, and regular heavy lifting. Okay, so the main thing you're seeing here is the issue of straining. Okay, anything that's going to put a pressure in that area. Now, specific to the regular heavy lifting, you know, there's something about like if working out and lifting weights throughout my life, I always, thought about working out that it's always a positive thing. How could that put me at risk for, something like hemorrhoids, right? But actually, if you just think about squats. Now, myself, I've always had really a deep squat depth. I've just been a person who's been a believer in that. I felt it benefits my lower back. It helps me to get stronger. Now, in a powerlifting meet, I'll put a photo up here. Really, you just need to squat to depth and no more than that for it to be a good squat. You just need to squat to depth and no more than that for it to be a good squat. So the top surface area at the hip bone needs to drop below the top of the knee, if you will. And I'll put a picture up here. You'll see what I'm talking about. Now, you only need to squat to depth to meet that criteria. Any deeper than that does not get you any extra bonus points. So either you squat to depth based on that criteria or you do not. So if you squat ass to grass, so to speak, do the benefits outweigh the risk? The benefit, maybe you just want to show off that, hey, I squatted well below the depth. Or maybe you're paranoid that the powerlifting judge, you're not going to give him any wiggle room to give you a red light, if you will. You want it to be a white light, as in a good lift, so you're going to squat extra deep, right? So there's some things to be said about that. But again, it's the benefit outweighing the risk. If there's an increased chance, and there is, I'm going to show a website on here. Deeper to the squats puts more pressure on that area, the rectum and anus area. There's even an infamous picture on the internet, and I'll put that up here, of a censored version. I don't think you want to see the uncensored version of a power lifter was going for his 1 rep max PR personal best in a powerlifting meet, and had a prolapsed anus at the bottom of the rectum. Everything came out not a pretty situation. So definitely we know that can be a risk for creating pressure in that area, or you wouldn't have accidents like that. Although rare, it's an extreme example. It does indicate and show that squats, deep squats, if you will, can really exacerbate that situation down there. And I'm going to talk about in this video, like I mentioned, what are the issues going on and what can help with that. Not based on what I think, I'm not a doctor. I'm going to give you information based on what some of these websites will say. Some of them you can look up yourself, as far as you want to do your own research. All right, so the risk factors, as you age, your risk of hemorrhoids increases. I mentioned, earlier in my video. I'm not over the hill. I don't think of myself by any means as a really old person, but I'll be 49 in about 2 months. I'm not too far off from being a half a century or 50-year-old man. So these type of things are more, I guess, become more salient as you get older. You're like, oh shit, I'm in this demographic now. So as you age, your risk of hemorrhoids increases, and that's because the tissues that support the veins in your rectum and anus, they can weaken and stretch, and this can also happen when you're pregnant for women, because the baby's weight is putting pressure in that region. So I mentioned that earlier in this video. I've had some female clients rather, that I've done personal training with that have had this issue because they've had children. All right, so complications of hemorrhoids are rare, but they include, I'm not going to read all this here in the bottom, but you can imagine it's a very uncomfortable situation. You can look at this website if you want, the mayoclinic.org. So for the sake of time, let's go ahead and go on down here. So as far as some of the information I want to share in this video. Again, here's unsafe exercises, heavy weightlifting, high impact exercises with both feet off the ground simultaneously, running, jumping, or skipping. Intense core abdominal exercises increase downward pressure on the pelvic floor, cause pelvic floor muscle tension, making it difficult to relax. Some of the Pilates exercises. At the very bottom, here's the one I was getting at earlier. The deep squats increases pressure on the rectum, causing hemorrhoids. Some yoga poses involve in deep squats. So, all right. So what are some things that can help? Let's talk about that. So things that can help prevent hemorrhoids or even treat the situation based on some of the research I've looked at and on the internet as far as different websites. Let's talk about garlic. So this is the livestrong.com website. You can look at this yourself and you can do your own research on your own. I'm just sharing this information of what I've seen that's out there. And I have some clients that have actually shared their own experience with garlic, and they said that it was beneficial. So how to use garlic for hemorrhoids. Now here's something that I've seen of garlic. I've seen some literature that says you can eat garlic. Some will mention eat as many as three cloves per night. I've seen differences on the amounts before they become inflamed due to constipation, pregnancy, or straining during bowel movements, or straining from exercise, as I mentioned earlier. So let's look at the garlic. Right here, it mentions consult your doctor prior to using garlic or any other substance for your hemorrhoids. All right, so that's what the website says. Step 1, check this out. They're saying you peel 1 garlic clove, completely removing the paper like pill that surrounds the clove. Step 2, you insert the garlic clove into your rectum like a suppository. It mentions you can add lubricant, which will make it easier. So basically you get the idea. They're saying to repeat this 3 times per week to decrease the hemorrhoid symptoms. The garlic clove will naturally be expelled when you have your next bowel movement. So step 4, chop 3 to 4 cloves of garlic to boil in 1 cup of water for 10 minutes. Step 5, strain the garlic pieces from the water and allow the water to cool completely. Step 6, saturate gauze pads in the water and apply the gauze to the area to soothe this is for external hemorrhoids. So there's 2 different ways based on if you have internal or external hemorrhoids. All right, so you get the idea here. And I've seen this remedy with using the cloves like a suppository. I've seen other suggestions where you actually put the cloves in a bucket, pour boiling hot water on them, and it creates the steam, and then you sit on top of the bucket to let the steam get into the affected area. And so there's different situations with the garlic. Now I've seen others suggest you simply just need to eat them. Okay, so all right, here's another website. This is instructables.com. Says the effects of garlic on hemorrhoids. Garlic has been known for its healing effects for thousands of years. It's one of the nature's most powerful antibiotics. So let me see. I'm going to kind of get to the parts that talk specifically about the hemorrhoids. All right. So, all right. But why does garlic work so well for hemorrhoid treatment? It has strong antibiotic effects and it kills harmful germs. It reduces blood pressure. It increases blood flow when applied directly. It's an antioxidant that binds to harmful free radicals. And it reinforces blood vessels. Well, that's real important because remember I mentioned earlier what I was reading is that as you age, those blood vessels, they might be overly stretched or just weakened, or maybe your nutrition, you're not getting enough nutritional support in your diet to help support having strong blood vessels and so on. So, and it also reduces skin inflammation. So, and there's some other remedies that are mentioned on here. I'm just going to read the garlic one, but you can go to this website. You'll see it up here on this video, instructables.com. And it's going to mention coconut oil, let me see, witch hazel, and so on. But I'm going to stick to the garlic for right now because these are the main. I'm going to mention the main 3 ones I found in my when I was looking up this subject. All right, again, garlic for hemorrhoids. This is the progressivehealth.com. All right, so garlic is often described. Okay, I don't need to read that. So basically, recent studies have identified the active agent in garlic. This active agent is called allicin, if I'm pronouncing that correctly. Allicin is responsible for most of the health benefits of garlic as well as its aroma. Therefore, it's important to use garlic a garlic source that gives off the distinctive garlic aroma. That's one thing I notice. If I buy garlic capsules, I want to make sure that they have that smell. So I'm getting the real McCoy, if you will. So let's see how it works. All right, garlic may be used again as a suppository to get rid of hemorrhoids. It works by reinforcing blood vessels and destroying germs in the rectal region. It also reduces skin inflammation. Garlic has anti-inflammatory properties that soothe the inflamed area in and around the anus. The astringent properties of the herb assist in quick recovery of damaged walls of the blood vessels. A garlic enema, well, here you go. Now we have a garlic enema, can cleanse the intestinal tract and reduce discomfort and passing bowels. So what I've seen is it helps strengthen the blood vessels, and which is going to be important if it's strain that's causing the issue of the swelling, which is the hemorrhoid, the internal ones, and external as well. So you get the idea here of the garlic. It basically helps with inflammation. It's going to help with the blood vessels and so on. So garlic is one that I saw come up quite a bit in my search. And there's different ways in which garlic can be used to enable the hemorrhoids to shrink to size. And this is the shrinkhemorrhoidsfast.com website. So again, this is going to mention the suppository. This one right here actually mentions down here eating the raw garlic on a daily basis will help with preventing hemorrhoids. Some people may not want to do something like, the suppository, and I don't blame them. So maybe just, it's right here. It says eating raw garlic on a daily basis will help in preventing hemorrhoids from occurring, again, for those who've had them already. Since it could cause uneasiness when consumed on an empty stomach, chew a raw garlic clove after having a meal. And I eat garlic because it's good for my immune system, so I will say that. Definitely with a meal, you don't want to eat it on an empty stomach. So, all right, number 2, let's talk about vitamin C. Vitamin C. So this is the progressivehealth.com website. So how does vitamin C help hemorrhoids? So as mentioned, other literature I've read, but also this article up earlier, vitamin C is a wonderful vitamin to add to your supplement routine to help fight hemorrhoids. Vitamin C essentially works to improve the vein health. Again, there's the word vein health. The other one, garlic, is your blood vessels. So that's important because if it's an issue of weakness of the blood vessels and they're stretching out, that they're swelling, if you will, that's what's causing the hemorrhoid. So if you can improve the integrity, if you will, of the blood vessels, to me that makes sense. They're going to be stronger, right? So vitamin C, according to right here to progressivehealth.com in their article, it works to improve vein health and provides several benefits that can prevent the formation of hemorrhoids and help them to heal faster. Vitamin C is a water-soluble vitamin, and humans do not make the vitamin in their bodies. So this means that you have to consume vitamin C every day to ensure you have enough to keep your veins healthy, not to mention the millions of other ways that vitamin C benefits the body. So I want to mention, for me, I eat red bell peppers every day. I'll post some photos because I want real vitamin C. I get vitamin C from my food, and the red bell pepper is very rich in vitamin C. So I'm gonna, I can eat, and they're sweet. I like the way the red bell pepper tastes. It's sweet. It tastes good. I can eat it raw, no problem. Not so much the green bell pepper. I don't like the way that one tastes, just raw. So the red bell pepper is my go-to one. You can get vitamin C from strawberries and other food sources. There's a whole list you could look up on that. But the red bell peppers is the one I go to on a daily basis. So if you buy vitamin C over the counter, it says on the bottle, vitamin C as ascorbic acid. So I don't believe that's actually the same as vitamin C you get from food, from what I've read and from what I've heard from people smarter than myself. So I'm going to get vitamin C from food. I think you get the idea. And I want that every day. So if you want to increase your vitamin C intake on a daily to help with this situation, whether it's preventing getting hemorrhoids again, or if you're like me, you haven't had them yet and you don't want to get them and you want to keep it that way, I'm going to be doing these things right here to minimize my chances of being somebody who gets hemorrhoids. So vitamin C, it has other benefits to the body. So, hemorrhoids aside, it's just something you should be taking anyways. So the bell pepper, the example I gave, you want to make sure you're getting food to make sure you're getting the real vitamin C. So you definitely need to consume it. It says here daily. All right. So vitamin C is necessary for enzymatic reactions, for the biosynthesis of collagen and catecholamines, and is a powerful antioxidant. So vitamin C has been found to tone and shrink veins. Again, here's with the shrinking the veins part. That's very important for hemorrhoids. And to maintain the integrity of blood vessels. So that's going to prevent blood from flowing backward and prevent fluid from leaking out of the blood vessels. So citrus fruit and some of the vitamin C, well, there's vitamin C supplements, but I prefer to get it from food. Also contains bioflavonoids, which are able to reduce the severity of hemorrhoids and strengthen the veins. Again, here we see this mentioning of strengthening the veins, the integrity of the veins. So we see this mentioning of promoting healthy blood vessels is what it's getting at, okay? So there's other benefits of vitamin C down here you can look at in this website, progressivehealth.com/vitamin-C- for hemorrhoids.htm. You can see it up here on this video. So look this up, do your own research, but vitamin C is a good one. Now here's the last one I'm going to mention. There are others. Let's talk about stone root, or Collinsonia stone root. I've seen this one pop up a bit, and it's an herb. It's got a strong, unpleasant smell that some consider overwhelming. Now this one, it's been purported to treat things like bladder pain, swelling, and inflammation. That's pretty important for hemorrhoids, stones in the kidney and elsewhere in the urinary tract. Also for excess uric acid in the urine. It's also used to increase urine flow to relieve water retention and edema. These are the purported uses that it's supposed to help with. Now, as far as the hemorrhoids, there's a article. It's on American Botanical Council, cms.herbalgram.org. Now, they mention different botanical treatments for hemorrhoids, and on their list, they have stone root, which is used by many American herbalists as a treatment for symptomatic hemorrhoids. So the research on stone root is constituent studies showing that it contains flavonoids and saponins, if I pronounce that correctly. So there's other herbal stuff you can look up on here that is purported to help. But I think the garlic and the vitamin C, those two right there, are ones that I see people taking anyways. A lot of people already, we use garlic for a lot of reasons. Vitamin C as well. I take garlic and vitamin C. These other, remedies that might be out there, I would just be cautious, do your research. Make sure that it's something that you would, if you do have a situation that's serious, talk to your doctor first and see if it's right for you. This one on stone root, there are some side effects here, or interactions rather. So for example, if people are taking lithium, it does increase how much lithium is in the body and could result in serious side effects. So some of these things that are out there, just be careful if you're, if you're taking medications, for example, or you're not for sure. Definitely do some research, talk to your doctor, before you do anything. So the vitamin C and garlic, being that they naturally occur in food, in my opinion, those are probably going to be safer situations than, say, some of these other things like the stone root, for example. But nevertheless, go through your doctor, mention any concerns and so on. So this video, I don't want to go on too long, but I just wanted to kind of show some information, what's out there. There's a lot of other stuff, but I'm really more impressed with garlic and vitamin C as far as what I've been seeing. And also bring this conversation up with older people, because it's interesting how you kind of throw this topic out there, and older people are not afraid to talk about it. And you're like, oh yeah, hemorrhoids, right? As a younger person, more than 20 years ago, it was laughable. You laugh when you hear about stuff like that. You start getting older, and particularly with me being a personal trainer, having older clients, this is something people deal with. So this is why I want to make a video and kind of just have a conversation about it. As far as exercise, things that may be contraindicated. So if you're somebody who's symptomatic for internal or hemorrhoids and they're painful and uncomfortable, then yeah, you may probably don't want to be doing heavy loads of weight or trying to squat real deep. If if you're doing barbell squats, anything in which you got to brace and tense yourself, that's going to put pressure in that area, and that's going to be something you want to back off of. Perhaps use some maybe exercise, but do some lighter weight, lighter loads. Choose exercises, or maybe some of the machines may be more accommodating to allow you to perform exercises in a manner that's not going to put a lot of strain in that area, and just give it time to heal. Some of the nutritional stuff that was mentioned may help. I've heard a lot of individuals for their situation, and it may not be necessarily representative of you or everybody else, but I have got some feedback that it has helped certain individuals. So anyways, this is just my 2 cents. It's information. What are your thoughts and comments about this topic, which for a lot of people it can be embarrassing. It may be something people don't want to talk about. And so I've seen some videos on YouTube on hemorrhoids, and I was I guess I'm not necessarily surprised, but in YouTube you're gonna find topics on a number of things. But I was interested, I guess, to see that a lot of the comments on people who look up videos about this are varied. It's not just one type of individual. You got, like I mentioned, the women who've had children. You got people who may be overweight, sedentary, people who sit down a lot. But guess what? People who work out, apparently, yeah, you can get hemorrhoids too, and you may need to adjust your workouts. Reconsider certain things as you get older. Do you necessarily need to do ass to the grass squats? Either you're to depth or you're not. If you're doing powerlifting, you're not going to get any extra bonus points for squatting, an extra foot deeper than you need to for it to be considered a passable squat. So these are just some thoughts. What are yours? Do you have any experience with this yourself? What helped you if you had hemorrhoids, as far as something that maybe worked for you? Has it affected the way you work out? Is this something that's reoccurring, or is just a one-time thing? Are you a personal trainer? You've had clients that have dealt with this. How did it affect your programming in terms of some of the exercises you had your clients do, and so on? So if you haven't subscribed to my channel, I'd appreciate the support. I make topics on a lot of different things pertaining to fitness. Sometimes it might be about mental health topics and wellness, or just topics I may want to discuss, like this one today, which may seem odd, but it's just a reality. You can call it adult conversation. You don't hear too many young people talking about issues with hemorrhoids, unless maybe it's a young woman who's had children already who may be dealing with that. So until I make another video, have a nice day. And I hope this information was helpful at a minimum to maybe at least get you pointed in a direction to start looking things up. If you clicked on this video because maybe you're looking at a way to deal with your situation, if you have hemorrhoids, and you can start avoiding things that cause you to strain, looking at your nutrition, your things that affect bowel movements. Maybe you need to lose some weight, right? A lot of things that can be done to address this situation. So until make another video this weekend, probably later today, something on a fitness related topic. You have a good day. Thank you.